that should mental health be taught in school? I'm very happy that the sessions are in continuation. Where we stopped, we would be continuing from there. I am very glad to invite our guest, Dr. Shiv Gautam, who is a psychiatrist, very well known not only in Jaipur, Rajasthan, and India, all over the world. I'm sure the amount of awards that he has got, the amount of work that he has done, is so much that even one day would be too less to be introducing him. And I would also welcome Madam Preeti Sangwan, the principal of Bharatiya Vidya Bhavan, here to be discussing on this particular topic, and myself, Dr. Girija Singh, psychologist and a counselor. So, to begin with, first and the foremost, the initial point is where we would ask the principal ma'am the importance of teaching mental health to students. As a educationalist and heading the institution with a vast experience, she would be able to put across how important it is. Then we touch upon how it has to be dealt with. Yes, ma'am.
So good afternoon, once again, good afternoon, everybody. And thank you, Girja ma'am, for starting with the most important question. School and mental health. What is the connect and why is it important at school level? First of all, what exactly is the purpose of education? The purpose of education is that equip children with all the abilities and competencies and the right kind of attitude in life, so that they can lead a well-meaning life for themselves and can make a very positive contribution in the society, right? They should be able to appreciate life as an adult and as well as a child, right? Appreciate life means life will offer its own ups and downs. They should not get bogged down, by whenever any challenge they come across. So that's why it is the responsibility of the school to prepare the children to meet those challenges. Secondly, besides home, I think the second socialization framework or the second social unit in which a child is interacting, till 18 years or 17 years is school or school community. Child is spending almost 6 to 7 hours every day. So that's the reason school, teachers, the complete school community plays a very pivotal role, in framing the psychology of the child, how child feels about himself or herself, and most importantly, what we call it as mental health. What is mental health? So mental health is basically the way one feels, mentally, emotionally, and the social connect, right? So in case a child feels good, so that means yes, mentally, or we can say the child has a positive mental health, right? So since the child is spending a lot of time in the school, and the adults, as well as with the peers, they can bring a lot of change and they impact the child in a significant way. That's why it is important, right from the schooling days. There should be good emphasis on the mental health. As far as how it can be taught, my opinion is very different. I don't know whether to use the word teach mental health is right or not, right? So how exactly, children, they can be equipped to have a positive mental health? I'll take just one example because there are many, many factors involved, right? So in mental health, see, there are two factors. One is protective factors. Protective factors mean if a person has good self-esteem, it's a protective factor of mental health. So when this person will face any downfall or any, unpleasant, I would say unpleasant is again a wrong word, unfavorable outcome, right? The person will be able to deal with that outcome, right? So, where was I? I'm sorry, I'm really lost. Yes, yes. Have you ever come across this kind of a situation? Blank out. It happens quite often. And many times our children also face in the classroom, It's an example I'm giving you. In the classroom, where we feel the child is not prepared, right? When the child is participating in competition, right? So mental health cannot be taught. In such a circumstances or in such a situation or post such incidences, what a teacher is supposed to do doesn't matter. Next time, right? It happens. So ultimately, the attitude of the teacher, how positive she is, I would say the mental health of the teacher, everything rubs on the children, right? So I'm giving you one example because I know there's a time constraint. We'll come back to more examples in the discussion.
Okay. The very concept that ma'am said, should it be taught? Now let me tell you. Enculturation and acculturation. Enculturation is something, our language, mother tongue. We don't go to school to learn. It is taught. So, when it used to be the joint family and extended family, it used to be an enculturation of mental health. But now, because of the nuclear family, it has to be taught. And that is where the role of schools, psychologists, counselor, and ultimately the savior is someone like Dr. Shiv Gautam, the psychiatrist, where everybody would run for help. So, this, at the same time, it is being inculcated in the school how to be dealing emotional problems, how to be dealing social problems, that is SQ, EQ, IQ, another SQ, the spiritual quotient. I would request Dr. Shiv Gautam to throw some light, the red flag for the parents, teachers, and the institution when and how they have to be alert in actually teaching in the present time more than having it within them.
Well, this is 51st year, more than 5 decades. I've been working in the field of mental health. And people, I just completed 50 years and 51 years it started. 2 words are very important. One is health and another is human being. That is what we have to understand first before we understand anything else. And I'll talk science. I will not talk experience. Some experience comes through because after all the book of life has to tell you something, which will come later. When you talk of health, currently, health is not the absence of disease. It is a state of well-being, physical, emotional, social, and spiritual well-being. So you don't have to talk mere absence of disease. You have to talk of positive parameters which can be termed for health. Human being is a unit. It is a physical unit. We all have a body, we all have systems, we have nervous system, we have endocrinal system, and we have all bodily systems which affect not only the physique but also the mind. So it is a physical, psychological, social, and religio-cultural unit. We are all of us possessing all these parts of the system. So one has to look at the physique, whether it is influencing the health of the individual. And if health, then is it only physical health, or it is social health, or it is mental health, or it is a spiritual health as well. All these parameters which I am talking about, they influence all of us. So starting from the childhood, when the infant is born, the first experience is coming out of the womb of the mother, having stayed 9 months comfortably there, experiences a separation anxiety. You get separated from your mother. So far you were not worrying about your diet, your respiration, your temperature, your clothing, nothing. Mother looked after everything. But now, you will have to look after. And this anxiety makes you cry. First cry is a separation anxiety from the mother. And from that cry, the journey starts. Right? Then, as you grow, you interact with your peer group. And peer group is, you know what peer group is. You go to the Central Park with your family, elderly like me, older adults, adults like Narnolia ji, younger children, adolescents sitting in front of me, and some school children from KG to others. Go with your family. After half an hour, what you will find? Elderly are sitting with elderly, adults are sitting with adults. They form their groups. And these groups are peer groups. Simple definition of a peer group. Your mental and physical age brings you together. Somebody who's not mentally grown, he joins a peer group of smaller people, especially the retarded person. If you look at him, कि साहब ये बच्चा इतना बड़ा हो गया और छोटे बच्चों के साथ खेलना पसंद करता है, you know. And this peer group has lot of influence on how we grow mentally. So mental health is not just a matter to talk about, it influences us and it gives us quality of life. If your physical health is good, you enjoy it. But if you are depressed, you are anxious, you are fearful, you don't really enjoy that life. And it gives you a bad quality of life if you have a bad mental health. I'm talking simple things. Now physically, when you talk of bio, especially your nervous system, your endocrinal system and other systems, they influence your psyche a lot. Right? Socially, when you interact, abhi LGBT ki baat ho rahi thi. Ma'am made good comments when I reached here. यकीन मानिए मैं गांव का लड़का था. I studied in a Hindi medium rural school and we did not have a school dress when I started schooling. मैं तब तक कभी बोर नहीं हुआ जब तक मैंने मेडिकल कॉलेज में आके ये नहीं सुना कि लोग बोर भी होते हैं. Believe me, I never got bored in my life. लेकिन मेडिकल कॉलेज में आया, मेरे साथ के लड़के कहते थे यार आज बोर हो रहे हैं. तब मुझे समझ में आया कि बोर होना क्या होता है. Most of it is a learned behavior. Frustration, inferiority complex, everything is a learned behavior. So what do you learn? And what do you learn from your elders and what do you learn from your peer group? और अब जब बात स्कूल की आती है तो बच्चों की बात आती है. एक तो ये बात हुई. Second thing which is important is when you deal with, मैं तो एक पेन ड्राइव में एक बड़ा लेक्चर सा लाया था. I forgot about it. Maybe at some other time. I'll bore you with that lecture. But this is very interesting to hear. सवाल ये आता है कि कितने परसेंट कितने लोगों में बच्चों में प्रॉब्लम्स होती हैं, mental health problems. And her point blank question was, what are the mental health problems which children suffer from? One common misconception is children do not have a mental health issue. बच्चे में क्या mental health problem होगी? मैंने तो ऐसा कहते हैं लोग. It is not true. बच्चों में mental health problem, मैंने तो separation anxiety से बता दिया आपको कि इमोशन तब से फील होना शुरू हो जाते हैं आपको. And then the depression in children, anxiety in children, phobias in children, fears and phobias, school avoidance, bad school performance, scholastic backwardness as we call it, attention deficit hyperkinetic disorder. Children don't have adequate attention and they are hyperkinetic. अब मुझे याद आ रहा है जब मैं स्कूल में पढ़ता था, when we had a hyperkinetic child in my class, वो गुरुजी कहते थे छोरा तू 9 महीना पेट में क्या टिक्योर है, look at it. तो हमारे समझ में नहीं आता था, लेकिन आज मैं अटेंशन डेफिसिट हाइपरकाइनेटिक सिंड्रोम पढ़ाता हूं अपने मेडिकल स्टूडेंट्स को, तो मुझे समझ में आता है कि बच्चा जो बहुत ज़्यादा सक्रिय है, ज़रूरत से ज़्यादा अटेंशन डेफिसिट है उसका, उसकी बीमारी है, और गुरुजी कहते थे कि छोरा तू क्या टिकर है, यू नो. सो दैट इज द इशू. Many of the problems of children are, they go unrecognized. And what we did, क्योंकि मेरी आज थोड़ी सी व्यस्तता ज़्यादा है, कल और परसों 2 दिन मुझे हैदराबाद में इसी तरह से व्यस्त रहना है जैसे मैं आज हूँ. वहाँ कोई इंटरनेशनल कॉन्फ्रेंस में भी एक फेलोशिप अवार्ड होने वाली है, और परसों I have to chair a global session where world leaders in mental health will be present. So I have to leave for airport right from here. तो इसलिए मैं थोड़ा सा जल्दी सम अप करूँगा इसको, इशू को. मेंटल हेल्थ इश्यूज इन चिल्ड्रन. हमने 1982 में, कितने साल हो गए, 42 साल हो गए, एक एक्सपेरिमेंट किया था. गवर्नमेंट स्कूल्स के 22 स्कूलों के बच्चों को, 22 schools, in order to identify mental health issues in children, we trained school teachers as counselors. One teacher or 2 teachers from each school, such 44 teachers were there. And we said children need not be labeled as mentally ill. They should be provided whatever the problem is, anxiety, depression, hyperactivity disorder, scholastic backwardness भी आजकल बहुत ज़्यादा identify होने लगी हैं. Government of Maharashtra has passed a special rule to give extra time to children in class 10 and 12 for children who have specific SLD, specific learning disorders. Okay? So all these problems are being identified in now, but those days, hysterical behavior, children getting unconscious in the school premises, not able to handle the conflicts of life, or children getting depressed, not paying enough attention to the teacher, not paying enough attention in the classroom. How the teacher can identify the child in the classroom who is having some emotional or mental health issue? And believe me, 44 teachers, we requested the principals to provide 1 day free for them and have a school counselor. These days, it has become mandatory to have a counselor in every school. It is the result of our hard work which we have done for more than 40 years, that all schools now have counselors. All schools have people like ma'am who help children.
Also special educators.
Special educators also. There is a separate group. I am not going into the special issues and gifted children and other issues. So those 22 schools, 44 teachers, we followed them up for 2 years, and we found that they are identifying problems in the schools which were not otherwise identified. I'll just give you one example where a mental health issue is related to family and environment. I would not name the school. First phase, the teacher should help the child, counselor teacher. If the counselor teacher has not succeeded and the child's behavior has not improved, then this child should be brought to a mental health expert in order to see that the child is not stigmatized. Okay? Stigma is a very important issue when you talk of mental health issues. Only two examples I will share and then I'll stop. So this girl was brought to me कि साहब बड़ी bright लड़की थी, always scoring 95% plus, and she has become absentee. She doesn't come to the school. She has started faring very low, and what has happened to her, and when we ask her, the child is dumb, does not speak at all. रोने लग जाती है. तो डिफरेंशियल डायग्नोसिस करते हैं डॉक्टर लोग तो कि भाई डिप्रेशन है, स्किज़ोफ्रेनिक विड्रॉन है, क्या है उसको. The child was brought to me. When I interviewed this child, what was found that she is the oldest of the home, oldest sister in the house. The father is an alcoholic. Mother and father usually quarrel, and the mother has gone away from the home. Look at the social situation. Mother has left this father. This father comes late, drunk, and this 12th class, 11th class student has to take the role of the mother. She has to look after the younger two, send them to the school, and in the process, she becomes late and she avoids school. Is it a mental health issue? It's a social issue. So what I did was, said, call your parents. I treated the father's alcoholism. Mother came back home, and the same girl passed with same 90% plus marks in 12th. So mental health issue is not only the individual's mental health, it is the family, the environment, how threatening it is, how good it is. It makes a lot of difference. Second example I'll give of a principal, not of a student. When I started mental health program for the schools, that was also in 90s, when I was an assistant professor or associate, I don't remember. I would not again name the school. A very learned principal, I went to the various, I do things which are beyond my usual protocol. Taking care of school children is not a work of a professor of psychiatry of the medical college. But I like, it's my passion. So when I reached this school, I said, this is my program. I run a school mental health program. What, Dr. Gautam? In my school, there is no child who requires mental health help. So you can go straight away, she told me. I said, fine, no problem. But if at any point in time you need me, please let me know. And I left the school. Just with 2-sentence dialogue. What I did was I started collecting the data of children who are brought to my OPD in SMS hospital from the same school. It was a research work. I instructed my resident doctors कि भैया इस स्कूल का कोई भी बच्चा है, उसके डायग्नोसिस के साथ और प्रॉब्लम को फाइल्स को अलग रखते जाओ. And 3 months later, with 43 students' name, I had the data with me. Then I called the principal again, ma'am, I want to see you. I said, I told you not to see. I said, still I want to see you. Why? Then I have some very important information for you. Okay, you come. I said, I will not tell you the names of the students because it is anonymous. And it is not my ethical right. It is beyond my ethics. But I can tell you in last 3 months, I have had 43 students coming and I have data. She was surprised. I'm sorry, Dr. Gautam, I did not know. I said, this is a problem that we do not know. More we know that we do not know. It's a dictum of understanding. And it is the same school who runs a regular school mental health program in the city of Jaipur, and it's one of the good standard school. So with these two examples, I think I'll stop here. But let me tell you, in schools, right from scholastic backwardness to depression to anxiety to school avoidance to phobias, specific learning disorders, and lately what I'm seeing is the screen addiction, which is very important. It has been brought into the armamentarium of the mental health issues. I'm seeing a lot of boys and girls, young boys and girls. मुझे याद है पुराने ज़माने में जब लेडीज़ काम करने के लिए जाती थी तो अपने बच्चे को थोड़ा सा अफीम देकर चली जाती थी, और वो बच्चा अफीम के नशे में सोया रहता था दिन भर, और जब वो काम करके लौटती तो बच्चा सकुशल जाग जाता था. हम क्या परोस रहे हैं? The mothers are giving this bloody instrument, which will be, let me tell you today, I may not be there after 15 years. I'm 73 now. But if I'm there, I will still tell you that people will throw it in the ocean. ये इंस्ट्रूमेंट लोग समंदर में फेंकना शुरू कर देंगे, क्योंकि ये इतना नुकसान समाज का कर देगा कि आपको अंदाज नहीं है. ऑलरेडी कर दिया, चल रहा है, बट स्टिल. तो वो क्या करती है, माँ बेटे को पकड़ा देती है. Surprisingly, 2.5 to 3 year old child is screen addict. Can you imagine? And the scientific evaluation research tells us that the structural change in the brain is same. Structural change of the neuronal structure is same in screen addicts which you find in opium addicts. MRI studies, PET scan studies have shown us, and the evaluation of the cerebral blood flow had shown us that the structural change you have in the brain is similar in screen addiction what you have in other opium and opiate addictions. So where are we going to? This is another issue which I bring to the notice. तो मैंने आपको कचरा बता दिया, लेकिन हाथ में झाड़ू नहीं दी कि कैसे साफ करना है. ठीक है ना? I have shown you the dirt which is all around in the society. I have still not given you the jhadu, and I think I should be invited again because the jhadu is very big. It has a big role to, and how it is to be used. But I'm sure the counselors sitting here from different schools, teachers sitting here from the different schools will take up this jhadu, not the jhadu of Delhi. Okay? Not the jhadu of Delhi. They will clean this environment, and all of you will be instrumental in cleaning this environment to see that our children do not become screen addicts. Our children have good mental health, and our children proceed towards positivity, which she talked about. Positive mental health is very important, and lot of it can be deliberated. Last word, मेरे को जाना है मैडम, इसलिए बोल रहा हूँ मैं. Last word, we had a conference of the principals of Vidyashram schools 2 years ago, and we had a almost 2.5 hour session there, and I was with principals of the entire country, talking about various mental health issues and how they can be handled in the school. So as many principals are sitting here in the hall, or the people who can influence principals, I would suggest them to start this program, because if we do not start school mental health program now, it will be too late and we will regret for it. Thank you.
Thank you, sir. So, this is the science behind the mental health, which is a fact. Now, as a counselor, I'm bridging the gap between the science and also the school and the parents. Now, let me tell you, as Sir said, there are mental health problems among the children. Of late, it has increased so much. So, the next point, yes, thank you so much, sir.
I wanted to join you in the question answer session, but for two reasons. Partly, sir and ma'am are responsible because they took half an hour before I before I came. The session was late, and partly because I have pressing assignment, I have to leave.
थैंक यू
Thank
थैंक
Thank
यू सर
you
थैंक यू
so
मैम
much for giving your
मैं बुलाना
valuable
चाहूँगा सुनील वर्मा जी को आप डॉक्टर शिव गौतम जी को मोमेंटो दें
बहुत लिए हैं यार आपसे. This is a real honor. This summit has been listed as one of the top of all educational summits in the country, and I congratulate Nanolia ji for that.
आफ्टर प्रीति सांगवान मैम प्रिंसिपल भारतीय विद्या भवन विद्याश्रम जयपुर सुनील नारनोलिया जी प्लीज कम कंटिन्यू ओके ओके थैंक यू सॉरी
We'll take a second for them to settle down. So it is like an interval in the movie. So we were talking about the science and the facts. Now, who is bridging the gap between the two? That is, we know very well that there are mental health problems among the children. Not that it did not exist centuries ago, it did. But at least we have got to know the problems. The next big challenge is the school authorities, the management, the principal, the teachers, they know they have various tests to assess also. But the next challenge is when the child has some learning disability, attention deficit problems, it is the parents who actually get disturbed. They say, no, my child cannot be having these problems. The earlier they get to know the problem, the better it is that they would be able to deal. So the next challenge is with the educational institutions, especially the principals, counselors, and the teachers, without even offending the parents, making them understand that if they realize that the learning disability or any disorder, earlier it is diagnosed, the better it is for them to be dealing with the child. So, as a school head, what are the challenges and how do you deal with it, ma'am? That is very important.
So Girija, the example which you have shared, so it is about mental disorder, right? Handling mental disorder, especially with parents, I would say so far my experiences is not
It
very
could be
tough.
as simple as learning disability or a special
Poor
child,
concentration
borderline,
and thus
yeah.
poor scores as
Yeah.
well.
Slow
Losing
learners.
interest in academics and in co-curricular activities. Okay. So first of all, we need to have a very systemic approach in the school. For example, as Sir has already shared and all of you are already aware, having a counselor is compulsory, is mandatory, right? But besides having a counselor, what exactly is the role and how exactly the counselor will reach out to each and every child? That is very important. So I'll share the mechanism which we have in our school. One, counselor has a timetable. And in the timetable, maximum time she is devoting in one-to-one interaction and writing reports. Her observation and writing reports, right? So it's not a weekly timetable. It can be a monthly timetable where she's trying to reach out to maximum number of classes. In case the school is even bigger, so it can be a quarterly timetable. For example, like in my school, I have close to 3,700 children. Okay, so certainly counselor will take a long time to reach out to each and every child, or to understand where exactly the problem lies, in what all areas, middle school, senior school, primary, and all that. The other mechanism which we have in our school is on monthly basis. In the first week of every month, counselor, she shares one format with all the class teacher and subject teachers, wherein, the teachers and the class teacher, they're supposed to mention if they come across any issue, right? For example, low scores, very aggressive, okay? Increased absenteeism, right? Retreating to silence, as sir mentioned in his example, right? So the teacher, the class teacher, because the class teacher is quite close and she spends, every day clear cut 20 minutes or 30 minutes, what we call it as a homeroom period, where the entire idea is to have a bonding with the children. So she's in a better position to make such observation. Otherwise, a subject teacher can also fill up. So that form goes to the counselor. First interaction she has with the teacher who has given this reference, right? After understanding the case, then the second thing is interact with the child, right? Prepare a complete plan, right? And all these monthly reports are, shared with the coordinators and vice principal and principal, right? And in case we find that certain cases are really very serious, we discuss, and then the decision is taken, should we call the parent or not? Your first question was why, taking care of mental health is very important in school. Because yes, school has to act in a very responsible fashion. First of all, like if we feel that yes, the case can be easily handled, in-house, by teacher, by counselor, it's not a very serious case. We need to observe for at least say 10 to 15 days before we make this announcement or this judgment that parent intervention is required, right?
Yes, yes.
Okay, so let's give some time. Yes, once we have understood that now parents should be informed, perhaps professional help is also needed, right? That's why the intervention is even more important. Then yes, parents are called. I would say that more or less parents are quite understanding. Perhaps I get to be more candid, at least in my office. This is what it happens, right? Closely we need to, observe the child. After having interaction, whether situation is improving or it is further deteriorating, right? So this is the systemic approach I would suggest a school must have. Besides this, apart from counselor, this is my personal experience. A teacher can be an excellent counselor. Ultimately, child listens to that person in case the problem is not very severe, if it doesn't require a professional help. Okay, if it is a behavioral issue only.
Yes.
Right, okay. So child trusts the person who cares, who trusts the child, who shows confidence in the child. That's why most of the time, the teacher, she plays, again, I would repeat the same word, very pivotal role. Right, so this is the answer to your question.
Yes, definitely. So, if we look into the fact, it is the biology, the thought process, again coming back to the emotional, social, IQ, spiritual quotient, which is very important. When we talk about the holistic development of the NEP, also is concentrating the same, wherein the school is also giving importance to it, and the family is also supposed to be giving importance to it. And this is the first step, wherein when we are talking about teaching mental health in school, has to be coordinated with the family, with the peer group, of course, which has to be supportive. The teachers play a vital role, and the educational institution also plays an important role because it is the need of the hour. And as Dr. Shiv Gautam mentioned, the addiction to the mobile is something which is the latest addiction, which even the parents unknowingly put the habit. You see, when both the parents are working, I have counseled the parents wherein even a 3-month-old child is handed over a rhyme, or it could be just a simple cartoon, but the child is getting addicted to that even while having food, even while drinking milk. So who is putting this habit? It begins from home. Home is the first school, and then school. the academic one. So I think with this, we come to a conclusion that if we coordinate in this manner, most of the problems what we discussed in the morning also can be dealt. So family is the first school. I think now we could open for questions. If there are any questions pertaining to this, I'm sure ma'am would be able to answer. I will also be able to answer.
मैडम ने अभी कहा काउंसलर के लिए कि हजारों बच्चों तक हर एक को अलग अलग पहुंचना होता है। मेरा ओपिनियन ये है कि बारिश की मौजूदगी हर दाने पर तो अलग अलग बूंद नहीं डालती। एक काउंसलर का भविष्य बदलने वाला है। अब आपको हर बच्चे के पास पहुंचने की ज़रूरत नहीं है। हमारी जो न्यू एजुकेशन पॉलिसी है उसमें चेंज ये आया कि पहले ये करियर ओरिएंटेड एजुकेशन सिस्टम था, लेकिन अब ये सेल्फ एक्सप्लोरेशन की तरफ जा रहा है। काउंसलर की भूमिका क्या होती है उसको बड़े कैनवास पर समझने के लिए मैं आपको एक प्रपोज करता हूँ, रोल ऑफ इंडियन एजुकेटर एज एन इंजीनियर ऑफ साइकोवेयर एंड सोमेटोवेयर। कंप्यूटर से कंपेयर करिए लाइफ को। आपका हार्डवेयर और सॉफ्टवेयर इंडस्ट्री दुनिया का आज सबसे बड़ा इंडस्ट्री है, लेकिन अब इसको बीट करने वाला है इंजीनियरिंग ऑफ साइकोवेयर एंड सोमेटोवेयर। हम गिफ्टेड बायो कंप्यूटर हैं और हमारी जो गुरुकुल परंपरा थी उसमें जो कुलगुरु निकलते थे वो आज के काउंसलर्स हैं। और आपका बहुत बड़ा रोल है। 15-20 दिनों की छोटी सी ट्रेनिंग से ये भूमिका आप समझ सकते हैं। और इसमें कुलगुरु के बारे में मैंने जैसे आपको बताया, गुरुकुलों से जो निकल रहे हैं वो आपकी भूमिका है। हर 200-300 परिवारों पर एक कुलगुरु हुआ करता था और कोई भी व्यक्ति कुलगुरु की सलाह के बिना काम नहीं करता था। लेकिन आज की तारीख में वही कॉन्सेप्ट घूमकर यूरोप से आया है। पहले स्पोर्ट्स में कोच की ज़रूरत होती थी, उसके बाद बिजनेस में कोच की ज़रूरत हो गई, फिर ये एजुकेशन में कोच आए हैं, फैमिली कोच की, और अब पर्सनल कोच की ज़रूरत है। एक छोटी सी मोटरसाइकिल भी ख़राब होती है तो आप मैकेनिक्स को बुलाते हो, लेकिन हर आदमी अपने आप को, बच्चा भी और बड़े भी, ये समझते हैं घर में कि हम सब कुछ जानते हैं। कितना जानते हैं? आपस के रिलेशन नहीं मैनेज कर पा रहे हैं। कॉरपोरेट सेक्टर में और ऑफिसों में हज़ारों टॉर्चर बर्दाश्त करते हैं सैलरी के लिए, लेकिन बच्चों को और घर में माँ बाप को आपस में डिस्कशन करते हुए सुनते हैं कि इट इज़ माई प्राइवेट लाइफ। ये क्या हो रहा है? तो गुरुकुल की हर जगह ज़रूरत है। हर 200-300 परिवारों पर एक कुलगुरु चाहिए और एक बहुत बड़ा कैरियर अपॉर्चुनिटी है। इस विषय में लंबा डिस्कशन है। आप लोग जब भी कभी मुझे दोबारा मौका देंगे मैं बात कर सकता हूं, लेकिन मैं अपनी ये बात आप सबके सामने रखना चाहता था। मुझे अच्छा अवसर मिला आपके बहाने। थैंक यू।
Any other questions, please?
So any student would like to ask any question? Before we wrap up, before we wind up, just one suggestion in one line. Most of the time, the reason for disturbed mental well-being or negative mental health is lack of discipline, which is missing in all. It is not only in youngsters. I remember like the way we have been brought up. I'm talking about because we belong to previous or maybe previous to previous generation as compared to those students who are sitting in the hall right now. There used to be a routine in the family. Follow a routine, children. There's a time to wake up. Okay? There's a time for everything. If we simply follow this routine, because right now, see, 24/7, entertainment is available, information is available. So the problem is not only with the children who are not doing well in academics or in co-curricular, even with the bright children as well. There's a problem of mental well-being. And perhaps, yes, gadget is to large extent, the gadget is responsible. But ultimately, it's a matter of discipline, which a child learns from the environment. So at home, from parents, and in school, from us, from teachers, right? Thank you.
Okay. To conclude, I thank Dr. Shiv Gautam, who has just left now, and Madam Preeti Sangwan for having highlighted and brought in such a great awareness among all who's sitting here. And ultimately, it is not the responsibility of the society, not the responsibility of the institution, not the responsibility of somebody else. If each one of us take our own responsibility for a progressive growth of not only physical, complete, social, emotional, IQ, spiritual. Spiritual, I mean, have a principle of your own in which discipline is also a part. If you have a principle in life, then nothing is going to be wrong. That itself. So you can be your own counselor and a guide. That is the best thing. Thank you. We wind up with this.
Thank you, ma'am. I would like to call Dr. Alpana Saxena, Vice Principal, Subodh College, to provide memento. Please, ma'am. Preeti Sangwan, ma'am, Principal, Bharati Vidya Bhavan, Vidyashram, Jaipur. Ma'am, please. Alpana Saxena, ma'am. Please come. Dr. Girija Singh, educational psychologist. Thank you. Thank you all of the speaker. Thank you.